Leah, I'd love to hear you talk about the current approach that organizations are taking with regard to medical imaging to AI.
I think first we should talk a little bit about the impact to the physicians who traditionally have delivered this care, right? This can be a very scary and daunting idea, right? That some computer is going to take over their world, take over their job, take over their meaning in this space. And I think it's actually a legitimate concern, right? Because it does some things significantly better at this point. And so that's actually part of the conversation, is really talking with physicians about what does that new framework look like moving forward. And so I think from a health systems perspective or an imaging perspective, you really have to ask very practical questions around what it is you're getting when you attempt to implement AI. You have to ask good questions about, is there an operational efficiency that we are gaining by implementing this? Are we improving something clinically by implementing this? Or are we mitigating risk by implementing this? Those are really the three things that many companies are looking at to identify whether it makes sense to put something in place. One thing I will mention from an imaging specific perspective, imaging is so amenable to AI, right? Because you get millions and millions of images, which are really just patterns, right? And then you have millions and millions of discrete fields, ICD-10 codes, right, that you can match those up to. So the ability to apply AI in this field is really tremendous. But if you think about it, in order to implement an AI solution from the FDA perspective, you actually have to do it on a diagnosis by diagnosis basis. So it's actually a very painful process to go through for a company attempting to do this, right? So let's take chest x-ray, for example. They can't just say, I have an imaging solution for all of chest x-ray. It's chest x-ray specifically looking for pneumonia or whatever that might be. So it's a process to go through that. Many of these companies, what they do is they really join with a vendor and they co-develop to some extent. So they'll start with something that's already FDA approved, and then together they will look at additional indications and they'll work on that together and then submit that together. So we're in the middle of that process right now, and it's really exciting.